Hi, I'm Tom Pettengill, a therapeutic body worker in Berkeley, California. Today, Gabby and I are going to show a technique to adjust the SI joints, part of the hips. The technique needs to be done very specifically in the way mentioned, or else it will not be effective and can possibly cause more pain. A couple things to keep in mind. One, that if there is pain in the lower back, and in particular the SI joints, it may not be the right adjustment for the right time. The pain should not be intense, and the patient should be able to tolerate the procedure with minimal discomfort. Also, it's well known, the two SI joints in the back. And when they are adjusted, it's also important to adjust the third joint in the hips, and that is the pubic symphysis, commonly called the pubic bone. The technique that we're showing will adjust all three joints. So for the adjustment of the joints in the hip, the three joints, the two SI in the back and the pubic symphysis in the front, there'll be two main things that we'll do. The first one, Gabby has her feet up on the table, and I'm going to put my arm between her knees, and she's going to squeeze her knees together, and then we're going to rock. So let's do that one first. And go ahead and squeeze, but don't. And then I'm going to rock for about 20 seconds while she continues to squeeze. And then I'm going to stop, and she's going to continue the pressure on her knees, pushing inward, and raise her hips up off the table. Hold that for about 5 seconds. And this is just to a comfortable height. And back down. Good. And then the second one will be, I'm going to keep her knees together, and she's going to she's going to push her legs apart, and then I'm going to rock again while she continues to push outward. About 20 seconds. And then I'll stop, and she'll raise her hips up off the table while she continues to push outward with her knees. Hold it for about 5-8 seconds, and then go back down to the table. And all of this for Gabby should be pretty pain-free. If there's a little bit of discomfort, that's okay, but if there's a lot of discomfort, then don't do the technique. So again, Gabby's knees up on the table, my arm in between. She's squeezing together, and I'm rocking for 20 seconds. I'm going to cut it shorter than that. I stop. She continues to push in and then raises her hips up just to the comfortable level. Hold it for 5-8 seconds and then back down. And then the second part is where her feet are a little closer together. On the last one, her feet should be about as far apart as her hips. This time, she's pushing outward as I'm resisting that, rocking again for about 20 seconds. Stop. She continues to push outward with her knees and then raises her hips up off the table for 5 or 8 seconds, and then back down. Perfect.
Yeah.
Cut.